So what is AI orthopedic treatment? You know, the buzz is all AI these days, but in my practice, I'm going to talk about something today called augmented and integrative non-surgical orthopedics or regenerative medicine. And I have this technology sitting in front of me that I've detailed in other videos, but this is a Shockwave unit, and this is a laser unit. And these are using different mechanisms to stimulate healing in the tissue. This is a mechanical stimulus where we're putting acoustic waves or sound waves into the tissue that is inducing biologic change. Laser is obviously putting light and particle or photon into the tissue. So think about it as energy. How do we transfer energy from these devices into a tissue to induce a biologic change in that tissue to help it heal? So in my practice, I use a lot of cellular treatments, which are different types of technologies, but they involve needles. So say we have a partial rotator cuff tear. This isn't a complete cuff tear in the shoulder that requires surgical reconstruction, but say we have a small tear, we have a condition called tendinopathy or tendinitis that is really stubborn to go away, hasn't been able to heal with time, hasn't been able to heal with your own mechanical modifications and corrections of what you're doing. Maybe you've worked with a good movement correction specialist like a physical therapist or an athletic trainer or personal trainer, and you just can't get this chronic thing to go away. Either one of these tools could be a great tool to apply that energy into the tissue to see if we can stimulate change, because we know those tools in front of me can stimulate change through opening up blood flow to the tissue, to inducing collagen production, to opening up a release of growth factors or nitric oxide, which helps dilate our blood vessels, that stimulates more blood flow to the tissue. So we know these by themselves can work very good. But say you've done those too, and now you're really stuck because, well, I've applied all the things I can do somewhat mechanically to the outside of the body, but this is still stubborn to heal. And this is where in my practice we have all the tools from a non-surgical standpoint. So if we can take cells, and I've detailed videos on things in that realm, PRP treatments, stem cell treatments, even old school prolotherapy. But if we take cells now and we're able to inject it down to the target tissue, and those cells can release growth factors to that tissue, and we can seed all this injured tissue with those growth factors to stimulate healing, now we can let the healing start, okay? And now we can apply one or both. In my practice, we're synergizing all this, right? We're putting the cells in there, and then we're stacking Shockwave and laser together after that to induce more healing, because I'm interested in two things for my patients: treating the definitive root cause as quickly as possible, stimulating the maximum amount of healing in this. But for me and the patient, we're hoping to get that accomplished in the shortest amount of time. So when we look at injuries and we look at the stepwise progression when we're injured, we know there's an inflammatory phase, because when we get injured, we tweak our shoulder, it aches, it throbs. We don't want to move it because we fire that muscle tendon or we fire that structure and it hurts. And in those first couple of weeks of recovery from that injury, your body's in what's called the inflammatory phase. So in the inflammatory phase, your body's trying to sort out the injury. It's cleaning up some of the injured tissue. It's taking out some of the metabolic trash that's accumulated with inflammation in that tissue. The next couple of weeks are what we call the proliferative phase or healing phase. This is when we proliferate, which means we induce healing by bringing in cell by cell blocks that can help heal injured tissue. So that's proliferation. It's where prolotherapy back in the 1950s got its name from. And so if we go through this proliferative cycle in the next couple of weeks, then we tip in, say, the next 2 weeks over here, say 6 weeks and beyond. This is where that tissue is actually getting strong. So it's very key in that whole healing progression that we have the time and the space to do it right. We modify the activities and we correct mechanics and deload the force on that tissue to allow it to heal. But think about all those things that I just mentioned as accelerators, right? Cellular treatments like platelets and stem cells. The problem with these tissues, especially when they become chronic in nature, they've been there for a while, they can't heal on their own. They've gone through 6 to 8 weeks of healing over and over, and it's still a persistent problem, then it is a tissue issue. And it's hard always to mechanically correct that away. Whether it's modifying your own activity or having somebody work on it or doing physical therapy correctly and the right amount of repetition on that, sometimes we just cannot get that tissue to budge, or you plateau at a certain point of 70, 80, 90% better. So then we have all these tools now available to us in the non-surgical regenerative realm to either use a shockwave unit, use a laser unit, use both of those together to stimulate more healing in sync with the corrective exercise you're doing with your treating physical therapist or corrective exercise specialist. And then if the tissue is still not budging, then we can break out the needles and we can induce change really deeply into the tissue, because we're putting that needle right down in the tissue target that needs that help to heal. And we can use all those together. So this is what I call augmented, integrative, non-surgical orthopedics or regenerative medicine. So if you're kind of looking at what is the latest and greatest, when somebody goes down with a major injury at a pro level or elite level, there's a reason why all these treatment tools are typically being used if that injury is not deemed to be immediately surgical, right? If it's surgical, it takes us down a different path by which, hey, some of these tissues, even augmenting post-surgery, I do in my practice for the right case and the right patient at the right time, because we can stimulate more healing after the surgical intervention's been performed that needs to be performed, or we can use these technologies here, shockwave and laser, to induce more healing as well. So we have all these tools available to us, all those tools available to you out there. If you're dealing with a musculoskeletal injury that A, has been deemed to be not surgical, or B, surgery's been put in front of you to explore at a future date if things fail, and you've looked at conventional treatments or worked through those conventional treatments and they haven't gotten you there, then man, there is a ton of technology now in offices like mine that we're using all these things to help you heal quicker, faster, and more completely, so that hopefully you don't spend more time on the sidelines, you spend your time back in the game doing what you like doing. So hopefully this content helped you understand augmented, integrative, non-surgical orthopedics. I know it's a mouthful. It's how I think about putting everything around the injury. If we're isolating this with one tool, if say I'm just going to town with shockwave and that's all I use in my practice over and over and over, you may get there, it may help, or I'm doing the same with a laser, or I'm just doing the same with physical therapy. But I think about using it all. What are all the tools we have out there? What are the colleagues I have that I can connect my patients with to help you, the patient, get there faster, understand the injury more important than that even is how to not get re-injured after the injury, but how do we put more pieces around the problem that you have? And when we synergize these things and we put all those things around it, our likelihood of success goes way up. The duration of time it takes to get better probably goes way down. And in my practice, that's what we see. And that's what most people are interested in, accelerating that time out of the injury zone back to the performance zone where they want to be. So if you liked this content, as always, like it, share it, subscribe to the channel so you can see when we talk about new fun technologies and non-surgical orthopedic regenerative medicine. And if I can help you in any way, in the notes always be underneath these videos is a link to my practice where you can fill out a short form and somebody in my practice can connect with you and explore the injury you have, figure out why it's stuck, and how do we help you get unstuck.